In late May, a 20-year-old college student arrived at a Los Angeles urgent care clinic in acute distress. She was barely able to walk. To maintain her balance and navigate the building, she had to lean entirely on the physical support of both of her parents. Those parents flanking her were Ben Affleck and Jennifer Garner. Despite ending their marriage in 2018, the two actors default to a unified, highly protective front the moment a medical crisis arises for their children, dropping everything to ensure her stability. But the image of a fragile patient needing physical support is difficult to reconcile with the rest of her life. The young woman struggling to cross that clinic floor is the exact same advocate who confidently commands international political stages. This duality shifts the focus away from the individual and toward the infrastructure of her life. It suggests that her ability to reach a global audience is inseparable from the personal safety net that supports her when she physically cannot stand on her own. The origin of this vulnerability dates back to 2019, months before the global pandemic made viruses the center of our daily lives. Violet contracted a post-viral condition. It is a lingering, debilitating syndrome where the medical system frequently lacks answers for the long-term effects of seemingly mild infections. Living with an invisible illness required her to adopt strict public health protocols. A high-filtration mask became a permanent, necessary fixture of her life outside the house. Maintaining those protocols meant pushing through intense cultural friction. She committed to wearing her mask even while navigating crowded, highly publicized environments, like the streets of Paris, right beside her famous, unmasked family members. The isolation of living with a chronic condition pushed her to look for her own answers. She transitioned from a passive patient into a proactive student, diving deep into rigorous systemic research regarding health inequities. That personal research eventually led her to the public policy stage, culminating in a powerful address to the United Nations. Instead of individual choices, her platform outlines 3 systemic demands for public infrastructure: improved air filtration, ultraviolet light systems, and healthcare mask mandates. These structural measures are our only defense against the relentless beat of back to normal, a mindset ignoring the reality of airborne transmission. To back up those demands, she anchors her advocacy in institutional credibility as an undergraduate student at Yale University. There, she connects her own medical history to much broader fields of study, focusing her coursework heavily on global health policy and climate justice. She has already begun publishing her research, including an article in a Yale Global Health Journal titled A Chronically Sick Earth, which examines community organizing in the face of the climate crisis. Her academic work grounds her platform in peer-reviewed data and systemic analysis, moving her message beyond personal emotion and into the realm of validated public health solutions. Which brings us back to that urgent care clinic in Los Angeles. That hospital visit marks the daily baseline reality of living with a chronic condition, a constant requirement for management that exists alongside her public life. Managing that reality requires intense coordination. Jennifer Garner has described their approach to raising children across 2 households as providing the necessary yin and yang to maintain a conscientious upbringing. When a physical crisis flares up, their ability to drop everything and present a united front gives their daughter the exact psychological and physical secure base she needs to recover. It is what allows the young woman who leaves a clinic in a walking boot to later stand tall and confident, commanding attention in the highest corridors of power. Those who are physically vulnerable are often the ones fighting the hardest for systemic change, but they can only sustain that fight when they have an unbreakable personal support system ready to catch them every time they fall.